Welcome to a special 4-part series of the Life-Changing Moments podcast. In our previous 2 episodes, we took a deep dive into the challenges faced by physicians on the street, the dedicated doctors in the trenches who shared firsthand accounts of the issues that impact their professional well-being. We heard powerful stories and identified critical challenges that need addressing. Now, we're shifting our focus from the trenches to the C-suite. In this series, we'll be interviewing chief wellness officers from 4 different healthcare systems to explore how they're strategizing to improve the professional lives of physicians. These leaders are at the forefront of developing innovative solutions to tackle the very challenges that our frontline doctors have highlighted. Now, throughout this series, we'll explore the personal journeys, passions, and innovative strategies of these officers as they share how they're thinking about and addressing current challenges, creating systemic improvements, and importantly, discussing the role that coaching can play in improving the lives of healthcare professionals. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life-Changing Moments. Well, to kick off this series, my first guest is Dr. Mila Felder, an emergency medicine physician and a leading voice in the realm of well-being. Dr. Felder has had leadership positions as medical staff president and medical director of well-being at Advocate Christ Medical Center. In the latter role, her groundbreaking well-being initiatives earned her the 2021 National American College of Emergency Physicians Medical Director of Well-Being Award. She is now the Vice President of Well-Being for all teammates at Advocate Health, where she oversees the well-being strategy for over 150,000 teammates. Nationally recognized for her contributions, Dr. Felder serves on the ACEP Well-Being Committee and is a voting board member of the Professional Well-Being Academic Consortium through Stanford WellMD. She has also made her mark through numerous publications and presentations on professional well-being. Outside of her professional life, Dr. Felder finds joy in ballroom dance, dog agility, theater, traveling, and reading, embodying her commitment to a balanced and fulfilling life. So, Dr. Mila Felder, welcome to Life-Changing Moments. It's good to have you on the show.
Hi, Dale. It's so nice to be with you here. I appreciate being invited.
You know that we're doing a series on professional well-being, and you and I were talking before we started recording that you already had listened to one of the episodes where we interviewed some sort of people on the street. One of the things you mentioned was it's interesting that getting people from the trenches is a way of understanding something about, what they're experiencing. You and I know each other some, and I know that that's something that you're always listening for is what are individual experiences for physicians in their work so that they can be more professionally fulfilling. But what I really want to do is start with you, which is, can you give us a little bit about your background and what your current role is?
You're absolutely right. Our lived experience have so much to do with what we are and who we show up to be for work, for our human life, for our families. And my lived experience started in former Soviet Union, and I grew up there, got married young, and came to the United States on the day Soviet Union fell apart. Interestingly enough, when we landed and found out that now we actually are from Ukraine and no longer from USSR, my husband said, well, I don't think we're from Ukraine because I don't speak Ukrainian. So in our US passports from 1991, in mine, it says I was born in Odessa, Ukraine, and in his, it says Odessa, Russia. Little we know, here we are, where it's actually very much political topic, not so much cultural. I went to medical school at Rosalind Franklin in Chicago suburbs. and graduated from residency at Advocate Oakland Christ Hospital, where it's a tertiary quaternary community teaching hospital with a lot of quite expansive reaches to cancer, transplant care, teaching, etc. I've been there ever since graduating from residency in 2005 and doing my ultrasound emergency medicine fellowship at that time. During that time, I've done a lot of physician leadership work, connecting it to what I've done before medical school with some administrative experience, and wanted to connect that life lived to the life lived within medicine, and also some human experiences with my parents getting sick and requiring more assistance and troubles balancing that life and my professional life. I wanted to integrate that into my professional journey. And so I started doing some well-being work at Christ, initially single department, then hospital, got into physician leadership and medical staff leadership, and very quickly realized that one, it's really hard to address well-being of one group without looking at how systemically we could touch on others. And doing that, addressing just one group, can easily create the situation where you're trying to build well-being, but instead create othering, those other people in suits, people who are nurses, and so I very rapidly became aware of how to approach it in a more holistic way and need to also go from where we started, which was a lot of social interventions, gatherings, get-togethers, fun things, massages, to organizational approaches and thinking about what may that look like. So that's both who I am and where I come from, and also how I ended up with well-being.
Wow. There's a lot of things I want to ask more about, but specifically, you have a title right now with Advocate. Can you share what that is?
Yes, my title is Vice President of Wellbeing for All Teammates of Advocate Health.
Yeah, which connotes what you were just talking about not necessarily isolating any particular subsystem, but looking at well-being amongst the different subsystems, if I'm hearing you right.
Absolutely.
So, maybe this will illuminate a little bit more about that journey, specifically around well-being. Are there some particular aspects of healthcare professional well-being that you're most passionate about?
I am very passionate about looking at the well-being as an organizational strategy. I feel that following on some of the work with Mayo and Stanford and others who are engaged in collaboration surrounding well-being, between 2000s and today, we learned that mindfulness meditation are wonderful individual tools, but in order to accomplish the goal of approaching organizational well-being, we need to look at it in terms of organizational intervention. So I feel very strongly that community building through peer support programs, allowing people to feel supported in the workplace through feeling safe, and connecting them to the resources organization has in place, which, believe it or not, frequently there's just such tremendous disconnect between what exists within the organization and whether and how people are able or not to access it. And that's a whole different topic of its own. Frequently we ask, are you able to access the resources? But really it's two questions. Are there resources, and do you know how to get to them? I feel that in that space, building organizational team of people that collaborates to create the resources, assess the resources, make them accessible, and continuously improve upon it is one of the things I feel most passionate about.
Yeah. And I think in a previous conversation, Mila, you had mentioned that the team that you're assembling, there's representation from these various subsystems within Advocate. Did I hear that right?
Yes, that is correct.
So there's some people that are focusing on physician well-being. There's others for nursing. There's others for administrative or other subsystems in the organization.
Yes, because there's difference between addressing isolated needs of just one group versus what I think is best approach, which is taking at every teammate working for us, thinking of their human needs and how they're best addressed, and looking at the special subpopulations that have specific needs. For example, clinicians, physicians and advanced practice clinicians and providers have some very specific needs within a shared domain of mental health. Those needs may be related to litigation, for example, or fear of board action. While all of us have mental health needs, especially thankfully with silver lining of COVID being more visible and more comfortably spoken about, but those specific clinician-related needs related to litigation need their very specific approaches.
Yeah.
And so we still need those specific approaches, but it does not exist separate from organizational approach. We care about mental health. We care about your mental health. We're going to normalize it. And we're going to build these resources because this particular group needs something additional that does not exist elsewhere.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests. Whether it's writing, painting, cooking, politics, and dozens of other topics, Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
Do you have any stories, specific stories or anecdotes that highlight the part that you're most passionate about with respect to this work?
Oh, yes. Early in my medical staff leadership at Christ, so in late 2016-17, one of my colleagues, an orthosurgeon, came up to me and said that his wife was working for United Airlines, and they had the program that trained every teammate working for United to identify distress and to be able to be a peer, just a listening peer. And with that the culture has improved dramatically. He said, how is it that we as a healthcare organization are not trying to do this ahead of the game? And based on that very early conversation, I had an ask, and a group of people got together, worked with organization outside Advocate, helped us build our own peer support ambassador program. as we rolled out that program in 2020, and we have some tremendous people building it, the initial thought was these were going to be peer supporters, right? They're going to support others because we're all healthcare workers and we're out to help each other. During that first training, a question was asked of how many of these signs or symptoms may you be experiencing, just as part of better ability to reflect and understand our own lived experiences. And the number of signs and symptoms of distress was sobering on average and for individuals. So we went from there to say, yes, the initial intent was to have a peer support program, but we're going to pivot a little bit. And we're going to say that this program is going to be about supporting you, the person that showed up today, to be a peer supporter. And we're not going to ask anything of you because we're going to offer you what you need. We're going to be here. We're going to offer you that oxygen first. And over time, as we build the army of people who have been exposed to this trauma-aware peer support ambassador training, we'll look to elevate organizational impact. And one of the first people that reached out to me after they received that training was my CMO, who said, I'm a better CMO as a result of having been through this. Without thinking about it, in the last 2 weeks, I've used this both at home with my family and at work. And I feel that I walk away feeling that I accomplished more and with more positive interactions as a result. And I think the reason for that is that there's really no magic to it. We're so frequently stuck in the checklist mode, getting things done. We're stressed. There is time pressure, financial pressure. It's so easy to put people in the category of other and assume malintent. But if we just pause, and this program really gives us a lot of opportunities to learn how to reflect on where we are as humans, what space we're in before reacting, then we really have an ability to show up better for ourselves as humans. And with that, walk away with better interactions.
You know, we could spend a lot of time just talking about peer support, but one of the things I wanted to highlight that I heard there was this notion of, instead of us focusing on training you how to help somebody, which is healthcare professionals' focus, is always kind of others focused, you paused right there and you said, oh, we need to focus on you first. What's going on with you? Tell us how you're doing. And thereby, if I might add, modeling how to be a good peer supporter, but also recognizing that they're human. They have their, as you said, lived experience as well. So I really just want to just kind of illuminate that and highlight that. That was kind of brilliant that you did that pivot.
And I would love to take credit, but truly the credit belongs to a wonderful team that built this program. And I was lucky that in the time I asked for this to come to us at Christ Hospital, there was no one who was ready for it. But as COVID happened, there was all of a sudden renewed energy in it. And it just grew very rapidly from 30 people in the first training, 30 plus people in the first training in July of 2020 to, again, an army of 2,800 today.
2,800 people who've been through training to be a peer supporter. Wow. And so this is across all teammates. This is
across everybody. When we first rolled out the program was initially 4-hour training, and we heard a lot of conversations getting the feedback from our clinical teammates that they don't have 4 hours to take away from their life. And this team came back with a shorter training that is focused on those that have clinical background. And we're still continuing the longer training that addresses any teammate who wants to join.
Well, that's great. So that's a good example of things that you've already been implementing at Advocate. I want to be a little bit broader here in the next few questions. So one is, what do you see as some of the biggest challenges that are facing physician and other teammate well-being?
I think that the broader challenges that our teammates face relate to some of the sense of isolation that's related to a number of things. Being in healthcare can be difficult. Some of the remote workers feel more isolated in a different way. But some of the othering we have historically done in healthcare creates that sense of I'm alone in this space. Be it's difficult to be a surgeon, or it's difficult to be an emergency medicine physician, or broader scope, being a physician is difficult, or being a nurse is difficult, and not seeing ourselves as part of a really large community of caregivers or healthcare team can be very isolating. So that's one issue that we're going to need to address. And then with that, a lot of issues related to just healthcare specific challenges, addressing flexibility in scheduling, being able to allow teammates who are clinical or non-clinical to allow that integration of their life outside work and work. A lot of the things we do happen after normal human work hours and outside of those hours on the weekends and evenings. And I think that some of that has been normalized here in the country, and the culture is that caregivers are human and giving and selfless. And it's all very true, but we're evolving. And with that, there needs to be some of the recognition of balance that is created by organizational recognition of boundaries and human acceptance of those boundaries. And so those are some of the big challenges.
So what I like about what you're saying is how there is not a one size fits all. We really want to individualize this. Everybody has different needs. What I also heard in there is some degree of kind of re-education that you don't have to be everything for everybody all the time. You can also spend some time with your family and spend some time out in the community. And that message is normalizing that message as well. Let me just ask, kind of getting more global again, are there some particular stressors or issues that are more pronounced now compared to in the past?
Yeah, I think that as we enter the healthcare space where employed clinicians create bigger and bigger component of clinician population, some of the challenges are in that we have multiple generations of clinicians. Some entered healthcare when they were independent practitioners. Some entered it during the time when both were prominent, and many now are entering it anticipating being employees. The expectations, the goals, the long-term visions are very different between those three mindsets. Mm-hmm. And the challenge is to bring everybody together and saying, you may, as a clinician who always practiced independently in private practice, not have wanted to do things a certain way. And now you may feel like you're being forced, yet here are the advantages of this employed model. How do we compete with it if we don't offer the advantages and the benefits of it? And the advantage of having a longer bench for the call schedule, having support people you don't need to worry about necessarily paying salary directly, having the malpractice covered, having so many things allowing us flexibility and approach to mental health, which is another big challenge, where you don't have to do things alone. And so I think that some of the opportunities that we have are right here in front of us. We are entering this just because healthcare has changed. Being open to that and the change itself, being open to that change itself is sometimes difficult for our clinicians. Mm-hmm. And that is because there's been so much lived stress with having to deal with, insurances and billing and all the different regulations sitting between ability to touch the patient with a stethoscope and ability to have a life beyond medicine. And our job as healthcare organizations is to try and reconnect people back to that purpose.
We're really still in the midst of a transition of different ways of practicing. So some are adapting well, some don't know anything different.
I have a friend who leads a component of physician engagement. She and I talked a little bit about her going on vacation, and she said she only dedicates this much time to checking her portal and email messages. And we kind of had a friendly back and forth about the vacation and what that means. And I think we all have to find our own boundaries of comfort, but as organizations, we have to offer support for where that's a choice you may want to make, but here's how we are going to support you in taking time away and living well.
So along those lines, what are some innovative approaches or technologies that you think might hold some promise for enhancing professional well-being? What's out there? What's new?
Some of the really interesting things that are happening now, and I know on your previous podcast, I heard a little bit of a reference to that, is artificial intelligence and how you could use technology to help in a few ways. One of them, simplify documentation and use that as a tool of using the time to spend more directed patient-facing time during the day for clinicians, which I think most appreciate. Also using artificial intelligence and technology related to that to minimizing number of tasks that may be not as heavily requiring clinician direct input, be it messaging or other non-clinician tasks. And so I think that's a huge area of opportunity. And that would address of the three domains you and I have talked about at some point before with Stanford. Practice efficiency is a great opportunity for getting all of the organizational and frankly national resources and investing in the tools that allow clinicians to spend most time with patients. And that means taking out things that are not patient-facing, documentation, typing, clicking. Can reduce the number of clicks. Can we use technology to help with better communication, communicating out messages, decreasing the number of emails in our mailboxes? And the list just goes on. So practice efficiency, I think, is one of the best opportunity areas where technology could help decrease non-clinician tasks. But even in the areas of human resiliency, there are opportunities to bring in some of the technology with apps that allow people time for reflection, like MoodFit is one of those apps. Prompt us to stand up, like Apple Watch reminded me just now that I've been sitting for too long. Things that allow us to connect our humanity and the reality of sometimes we're going to be too stressed to remember and have reminders built in to take care of ourselves.
Well, that's a nice segue to my next question. What are some things that you haven't talked about yet, healthcare professionals, can they do to take some proactive steps to manage their own well-being?
I love this question. Just before you and I spoke, I talked to someone who said, I just went to this amazing lecture and it was great until I got really angry because they talked about burnout and they showed a picture of the cliff. And I saw myself as being on that cliff, although I didn't say anything to anyone. And then it didn't follow. Nothing that here's what you could do followed. And so I walked away feeling really more distraught, thinking how much great information, but how little hope. And so I love that you asked the question of now what? I think that as clinicians, we have great opportunity to increase our own awareness and to shift our conversations with others and reflection for ourselves from what did you do? What's wrong with you? To what happened? How may I be here for you? I think that's the really golden opportunity because that allows us to reconnect to joy of practice with other humans, patients or other doctors or family members. And that brings people back from feeling disconnected back to why we're here. Having said that, some of the good things that exist already are greater awareness of mental health. And with that, lots of resources, many of which are free. I love my Headspace app. People find things that work for them, and it may not be for everybody, but being aware of how full or empty your cup may be, and then what fills it, and then who do you need there as part of your team that will help you be unafraid to say, I'm not well, or ask for help, but at the same time grow together, I think are some of the bigger things that we could do better as clinicians.
Sounds like, raising awareness. The person that you were just mentioning, her awareness got raised, but she didn't really have any, okay, what do I do with this? But so much of it is raising awareness of what's been my contribution to where I am right now and having some self-awareness around that. And then what do I do with that? I really love what you just said is how full is your cup already? And really carefully examining that, like, how did I get here? And what was my contribution to this? And that self-awareness. Along those lines, since we're talking about self-awareness, this podcast is produced by MD Coaches, which is a physician coaching firm. And I was curious from your perspective in your role, how can coaching play a role in improving the well-being of healthcare professionals?
There's some really great studies showing tremendous impact of coaching on well-being of the individual being coached and the environment surrounding them. And with that said, I think depending on the organizational approach to coaching, you could pick the person in the early stages of burnout and help them identify what the barrier is preventing that burnout. You could coach clinician to and through the leadership stages and develop a population and generation of leaders, creating an ongoing growth environment within the organization. Or you could choose to be at the very late stage and deal with burnout, coaching people out of burnout, which is a lot more difficult. And so just like we recommend to our patients frequently, prevention does it so much better than prescription. Similar, I think, identifying coaching at the very early stages of clinicians' career, medical school, residency, early career stages, and helping people find joy in medicine, even though sometimes it may not be what they initially thought their career would look like, allows longevity and a culture that feels human and supportive. So that's why I think coaching is best.
Let's say I'm a healthcare professional in your organization, or not necessarily in your organization, and this may get to the story you were just telling about the person who went to the talk on burnout. But I'm just curious what advice you would give to a professional that they acknowledge I'm really struggling with my well-being. But I feel kind of trapped in I'm working. I don't really see any way to work any other way than the way that I'm working. And I don't really have very good well-being or wellness. And even my relationships are suffering. What would you suggest to them are some first steps to move themselves forward?
I think sometimes the more we cut out others feeling like we're in this category, in this group of people alone, the harder it is to seek help. The reality today is that there are different stresses on every human. Normalizing that and saying it's just normal, it's just part of human life. Illness, suffering, sometimes death are part of normal human life helps one say, okay, maybe I'm more comfortable seeking help. Understanding that every organization is required to have support resources, and there's a plethora of those resources available, while also reminding people that even within their immediate network, there are very likely people who would be willing to step up and help by either taking a task or spending 15 minutes in one-on-one conversation. Empowering that ask for help, I think, is the biggest thing early on. So I think normalizing that some degree of distress is just human, accepting that we are human, and taking from there the fact that within any organization, including for private practitioners, just professional organizations, have resources within them built in just for that, and slowly starting to walk through the path of empowering yourself to take steps towards your dreams and your well-being in very small amounts. It does not have to be drastic turnaround and start from scratch tomorrow. But it may be about what really is in the way, what makes me unhappy, and which of these things I have control of that I can impact now. And so I think shifting that perspective from being a recipient to being in the driver's seat can be very difficult at the far end of the burnout spectrum. And that's where relying on others may help.
And another important thing I'm hearing you say, Mila, that I don't think we hear enough is that we're not alone. You're not alone in this. You're not unique. There are others who are experiencing what you're experiencing. And just to acknowledge that you're human. There's really not a lot of space in our training environment to be open about how we're experiencing things. And so we learn these skills of really not, letting some of that out. And so this is a relearning, if you will, of being open to ourselves and then open to this awareness that this is human. This is any human who's going through what you're going through is likely to experience what you're experiencing.
We tend to accept less, adapt, and move forward with less and less and less of what of our lives is available, normalizing that. Instead, I think what would be really good is, as humans, as groups of clinicians, as organizations, we normalize the fact that some degree of distress is normal, and accepting that in order to be able to see that outburst or that really stressful situation can be addressed by acknowledging what that resulted from, and finding a shared path together forward.
Which leads me to my final question. What are your hopes for the future of healthcare professional well-being?
My hope, and in many ways it's materializing as we are seeing this evolve, is that the combination of practice efficiency and cultural interventions in well-being and the human resiliency become one foundational approach for humans in healthcare. And with that, there are already right now a variety of teams looking at how to integrate all of that into well-being approach that touches on anyone, patient or physician or nurse or cafeteria worker. How may we best have that as a foundation? Not 5, 10, 15, 20 interventions, but instead foundation that acknowledges that we are going to have challenges and we're going to approach them by systematically looking at the way to improve practice efficiency and make it visible that we're doing it, so that even though it's not perfect right now, our teams know that we're doing it and they know how it's improving their life.
Well, Mila, this has really been a very rich conversation. I just want to comment that what I'm gathering from this, if I had to, there's no way I can summarize this, but the thing that's on my mind right now is the way that you are thinking about this as a leader in this space is both very individual and also very systemic. You are looking at all different levels of the system, from the individual to the small group to the department to the subsystem, that the professional subsystem, and how those all interplay with one another to create a culture of well-being. And I just really, that's very inspiring for me. It's what I'm taking away from our conversation.
Thank you so much, Dale. This has been so much fun talking to you every time it is.
I'd like to once again thank Dr. Mila Felder for her candor, leadership, and hard work on behalf of all healthcare professionals and ultimately the patients they serve. In our next episode, we'll continue our exploration with another exceptional leader in healthcare well-being, Dr. Christina Bowen. Her contagious energy and passion for this work will leap out of your headphones and inspire you. I'd also like to extend an invitation to all listeners. We'd love to hear your thoughts on the topic of professional well-being. What are your experiences in this space? We'd like you to visit the SpeakPipe link in our show notes to leave a voice message with your ideas, experiences, and suggestions. Your contributions might be featured in a future episode, helping us to continue this essential conversation. Remember, your voice matters. Together, we can make a positive impact on the well-being of physicians everywhere. Until next time, take care and be well. Thank you for tuning in to Life-Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.